Again, this afternoon, it's my task to share with you the HEOC Situation Report for today, February the 3rd. So between March 2020 and present, the Federation of St. Kitts and Nevis have reported a total of 39 confirmed cases of COVID-19. 36 cases have recovered fully. At present, we only have 3 active cases. These cases are being monitored as we speak. It's over a year now that we have been experiencing this outbreak from the SARS-CoV-2 virus. And so for this time period, over 103.2 million persons have been confirmed with this disease, and over 2.3 million persons have died from this microscopic organism. 26.4 million of these individuals, meaning those confirmed, reside in the United States of America, and over 446,000 died in the United States of America from COVID. Amongst the CARICOM member states, collectively, they have reported 92,048 persons confirmed with COVID-19, and they've reported over 1,704 deaths so far. Now this slide just provides you a snapshot of what's happening in the neighboring islands. So at present, our sister islands, a few of our sister islands are experiencing clusters of cases and community transmission. So in Anguilla, there are only 17 cases so far. They've reported 2 cases within the past fortnight. Antigua and Barbuda, their total number of confirmed cases stands at 234. Barbados, the total number of confirmed cases of COVID-19 is now at 1,558. St. Lucia, 1,411, and St. Vincent and the Grenadines just passed the 1,000 mark. It's just over 1,000. So this just gives you an idea as to what's happening, what's the COVID-19 status in our neighboring islands. In St. Kitts and Nevis so far, we have conducted well over 8,293 tests, meaning RT-PCR tests, and of this 8,293, only 39 have been returned as positive, giving us a positivity rate of 0.4%. Again, last week I would have shared with you that another batch of our USVM students was repatriated, a total of 147. 2 charters came in last Wednesday, one from Miami, one from Puerto Rico. So today, these students, these 147 students would have completed 7 days in quarantine. They have a remaining 7 days to go before they would be tested. So they will be tested on day 14 of quarantine, and once the results are negative, they would be officially released and allowed to integrate into our society and attend classes on the RUSVM campus. So at present, we have a total of 426 persons in quarantine, and as I said before, we only have 3 active cases. So these 3 cases are in isolation. They are stable, and then as I said before, 36 of our cases have fully recovered. All right, so this afternoon we are going to just look at what's happening in terms of COVID-19. Now, the emergence of SARS-CoV-2 variants is of concern. So at present, there are 3 SARS-CoV-2 variants of public health concern globally. All right, so there's one variant which was identified in United Kingdom, another variant in South Africa, and another variant a little closer by, and that's in South America, Brazil. So the UK variant, based on the studies that have been completed so far, it's estimated to be about 50 to 75% more transmissible than the original strain, and additional scientific information informs us that there is realistic possibility that infection with this variant is associated with an increased risk of death compared to infection with a non-variant COVID-2 virus. So this, to date, this UK variant has been identified in the Caribbean. So I think there are at least 3 CARICOM member states on which, this variant has been identified. And then it has it has spread to over 50 countries globally. The South African variant was first identified in South Africa in October of last year, and as of January of this year, already it has been identified in no less than 20 countries globally. This variant too seems to be more transmissible than previous variants, and this particular variant is associated with the possibility or the potential for reinfection. All right, so you could be diagnosed with COVID, recover, and then if you're exposed to the South African variant, you can come down. The chances are, or the risk of you being reinfected with this variant seems to be increased. The Brazil variant was first identified in December of last year, and to date it has been identified in 3 countries so far, and this variant is also associated with increased transmissibility as well as having the potential for reinfection. So in essence, we need to be wary of these 3 variants because they are all more transmissible. So that means the risk of more persons coming down with the infection is higher, and by extension, once you have more persons infected, you will automatically get more deaths. All right, 2 of the variants are associated with an increased prospect of reinfection, and 1 seemed to be associated with higher case fatality. However, based on the information so far, there appears to be no real change regarding the impact of the COVID-19 vaccines, meaning the leading COVID-19 vaccine candidates. So says the Director of Immunization, Vaccines and Biologicals at the World Health Organization. However, please note, scientific work and research continue regarding these 3 variants. So we will await further information, regarding these variants. However, our position locally or here in the Federation is that we really need to keep these 3 variants away from the Federation for as long as we possibly can. Just as we did the original strain, we were one of the few islands not affected by COVID last year, and so our aim is that we won't be affected by any of these variants anytime soon. So that's our aim, and we need everybody on board in this regard. So how can we achieve this? Well, we can if we get even more serious about the COVID-19 prevention and control measures, the wearing of the face mask. When you look at the literature right now, in those countries, meaning the United Kingdom, Brazil, and South Africa, individuals are now walking around with 2 face masks as opposed to 1. And the hope is that will reduce their risk of picking up this variant, which is associated with increased transmissibility. So wearing your face mask, very important, hand hygiene, and avoiding gatherings, medium-sized, large gatherings of persons. These measures will prevent the spread of any of these variants if they are on island. Very important. We were told yesterday that we come to this, in this forum, and we keep repeating the same things over and over again, and action is required. And I think the action that's required is for persons to recognize that, yes, each and every one of us, we have a responsibility to reduce the spread of COVID-19 virus locally. And there are some simple measures that we can practice, like wearing our face mask, hand hygiene. I've gotten accustomed to wearing the face mask now, and so it will soon become a part of you, and it's important because that's going to reduce the risk of transmitting this virus. Okay, so what's happening in terms of the COVID-19 vaccines? Today there are 63 vaccine candidates in clinical development, and about 16 have reached the stage of phase 3 clinical trials, whereby they seek to get all the medical information regarding the vaccine candidate. Now, 13 vaccines which have completed some level of phase 3 trials, their data have been submitted to the World Health Organization for consideration under its EUL assessment process, emergency use listing assessment process. So 3 vaccines have been submitted for consideration, and as we speak today, February the 3rd, only 1 vaccine candidate has already been approved by the World Health Organization EUL system, and that is the Pfizer-BioNTech vaccine. So, as I said before, the Pfizer-BioNTech vaccine has already been approved by the World Health Organization emergency use listing process. The AstraZeneca and Oxford vaccine is close behind. It's expected to be approved within the first week of February, so that's anytime now. Okay, so it's important to note that there are some Caribbean islands, that have already received and approved vaccines. So the United Kingdom overseas territories, which include Anguilla, Bermuda, British Virgin Islands, Cayman Islands, Montserrat, Turks and Caicos, they've already received the first batch of their vaccines, along with Guyana. Now, I want us to note that in St. Kitts and Nevis, the Ministry of Health, in particular the Minister of Health, well, let me just back up. The Federation signed on to the COVAX facility. We've shared this repeatedly. The COVAX facility is a global mechanism which was developed to help participating member states gain access to these vaccines. When you look at CNN and BBC, you realize it's only the bigger countries to date, they're the ones who have received vaccines. And so smaller territories like ours, we can access or gain access to the COVAX facility. So the Minister of Health recently received a letter from the Office of COVAX Facility providing us information regarding the first tranche of the COVID-19 vaccines that we will receive through this facility. So we were informed that we can expect to be distributed an indicative number of doses of the AstraZeneca and Oxford University vaccine. We have been allocated 21,600 doses, which will provide coverage for approximately 20% of our population. The start date of delivery is or can be as early as mid to late February. However, they were very particular in noting that this estimated delivery time is subject to change. It depends on a number of factors, and some of these factors include the World Health Organization emergency listing approval process and completion of the next steps. For example, the implementation of our vaccination deployment plan and the regulatory preparedness. Now, the estimated supply schedule indicates that 25 to 35% of this amount will be supplied probably towards the end of the first quarter, and 65 to 75% in the second quarter of this year. All right, it's important to note, ladies and gentlemen, that the Federation is also seeking access to COVID-19 vaccines through other mechanisms. And in particular, we are seriously exploring access to these vaccines through two other mechanisms. Access to the COVID-19 vaccine is crucial to curbing the spread of COVID-19 infections and restarting our economy and the economies in the Caribbean region and further afield. Okay, so what's the way forward? We are at the beginning of February, and it's about 1 year now since we have been engaged in this COVID-19 response. We've done very well, and so the question is asked, what's the way forward? And so we must, number one, we must continue to adhere to our St. Kitts and Nevis health and travel protocols, our requirements, which entails the pre-arrival RT-PCR COVID-19 test done within 72 hours of arrival is very, very important. We must continue that. And our 14-day quarantine or vacation in place, and it has been criticized. However, it is a best practice, and it has served us well when you compare what's happening in our neighboring sister islands. Number two, we must continue to maintain border surveillance. Ladies and gentlemen, we must continue to monitor our borders. Number three, we should or must access COVID-19 vaccines. The plan is to access enough vaccines that provides coverage for at least the first 20% of our population in the first instance. And then the ultimate goal is to attain a coverage that approximates the herd immunity threshold. The science is still out on that, but based on what we know about vaccination and herd immunity, it can be about 70, 75, 80%. So it really would be ideal if we can achieve the herd immunity threshold. If we do, this will reduce the risk of clusters of cases occurring and even community transmission. So ladies and gentlemen, I want to share the bigger picture. It would be nice if we can go through this pandemic with just a few cases and not experience any cluster of cases or community transmission. We can do so if we hold strain and continue doing what we have, and even be more effective in doing what we have been doing until we gain access to the vaccines and start to roll out the vaccines. Because once you start vaccinating our population, the individuals who are vaccinated, they would develop some level of immunity, having received the vaccine. And so if we are exposed to the virus, it wouldn't take hold. We won't get clusters. We won't get community transmission. And so that's the bigger picture. And I hope I'm being effective in communicating this, because, you know, I want us to see the bigger picture, buy into the bigger picture, and we can all work together to achieve this. We must maintain the COVID-19 prevention and control measures. So, you know, at one forum this week, somebody says, you keep repeating the same thing. We need action. Action. Let's all endeavor to protect ourselves and others by wearing the face mask, maintaining good hand hygiene when you go to the supermarket, when you go to the market, when you go to the restaurant, when you go on the strip. Maintain the adequate distance, avoid crowds. And if there is a small household party or gathering, you know, pay attention and try your utmost best to operate within the context of what we've been sharing. Thank you.